So hello friends, in this particular video we are going to discuss another infectious disease, that is your malaria. In previous video we have discussed about syphilis, Lyme disease, okay, and in this video we are going to discuss about malaria. So first, coming to the causative agent, so it is caused by, remember, it is caused by intracellular parasite, okay, intracellular parasite, that is known as plasmodium. You are knowing this fact. It is caused by intracellular parasite, that is basically known as plasmodium. Getting? Now coming to first life cycle and pathogenesis of this disease. Life cycle and pathogenesis. So before going into that, plasmodium vivax, plasmodium ovale, plasmodium knowlesi, okay, and plasmodium malariae, they also causes malaria, okay, but they have low level parasitemia. It can cause mild anemia, and it rarely causes, these are important points from Robbins, and it rarely causes your splenic rupture. It rarely causes splenic rupture and nephrotic syndrome. Okay, so plasmodium vivax, ovale, knowlesi, malaria, it can cause low level parasitemia, mild anemia, and it rarely causes splenic rupture and nephrotic syndrome. Clear? Whereas this plasmodium falciparum, can cause high level of parasitemia. It can cause severe anemia. It also has cerebral symptoms. It can cause renal failure, and it also causes pulmonary edema. So these are the characters which are associated with the plasmodium falciparum. So plasmodium falciparum is more potent, more virulent than these all protozoans. Clear? Now starting with the plasmodium falciparum. So host of the plasmodium falciparum are the two, you are knowing that human plus mosquito. So these are the two hosts which are related with this plasmodium falciparum. Okay, now we are going to discuss about life cycle. So okay, focus on this. These are important point in life cycle. We will discuss in a very easy manner. So first infectious stage of plasmodium, which is also known as sporozoite. So this infectious stage of the plasmodium, which is sporozoite, it is basically present in salivary gland, okay, salivary gland of female mosquito, Anopheles. So sporozoite, this is the infective stage. It is present in your salivary gland of female mosquito, and it will released into human blood during bite of the mosquito. Clear? And after delivering into the blood, within minute, it will invade and bind to liver cell. Within minute, it will invade and bind to the liver cells by binding to some receptors which are your thrombospondin and your properdin receptor. Okay, so this plasmodium will bind to liver cells using thrombospondin and properdin receptor, which is generally present on liver. Now within liver cells, parasite multiply, releasing as many as your 30,000 merozoites. This is the next stage. Okay, so the first stage, the infective stage, is sporozoites. Then in liver it will multiply and forms as many as 30,000 merozoites, and these merozoites are asexual haploid form. So this is very important. The merozoites are asexual and haploid form, and this number is per hepatocyte rupture. Okay, if one hepatocyte is rupturing, then it will release 30,000 merozoites, which are asexual haploid form. Clear? So this is important MCQ question, that is merozoites are asexual haploid form. Okay, merozoites are asexual haploid form. So this is important MCQ question. Here this is important MCQ question, and here this sporozoite is the infective stage for the infection. Clear? Now coming to the next point, that rupture of infected hepatocyte occurs generally after 8 to 12 weeks of infection. Clear? Now this infection of liver, here we have discussed the infection of liver. Okay, changing the color. Here the infection of liver and the development of merozoites. Here this whole stage is basically known as exoerythrocytic stage. What is known? Exoerythrocytic stage. Clear? Because it is occurring outside the erythrocyte. So this whole stage whole stage of the infection of the liver cell and the formation of merozoites is known as exoerythrocytic stage, and this stage is basically asymptomatic stage. Okay, there will be no symptom of the malaria during this exoerythrocytic stage. Clear? Now, so we have discussed about exoerythrocytic stage. Now moving to the next. After release of the merozoites, these merozoites will bind to, remember, this merozoite will bind to sialic acid residues which are present on your glycophorin molecule. Okay, this glycophorin molecule is generally present on RBC surface. So this merozoites using, remember, merozoite will use its lectin-like molecules. So using lectin-like molecules, these merozoites will bind to the sialic acid residue which are present on the glycophorin. Suppose this is your RBC, and RBC has this glycophorin, and this glycophorin has this sialic residue. So suppose this is merozoites has lectin-like molecules. So this lectin-like molecule will bind with this sialic acid residues. Clear? And after binding, that will cause invasion by active membrane penetration. Okay, that will cause invasion inside the RBC, and within RBC this parasite will grow in vacuole, and that in vacuole this parasite will release certain enzymes that will hydrolyze your hemoglobin. So there will be hydrolysis of hemoglobin through its enzyme. Clear? Okay, clear? Now 1 to 2 important points where I want to discuss here. Okay, the next stage is your trophozoite. So the first stage was sporozoite, that was the infective stage, then the formation of merozoites occur, then the trophozoite. So this trophozoite is the first stage of parasite in RBC, and it is defined by basically presence of single chromatin mass. Okay, presence of single chromatin mass is indicative of trophozoite. So this trophozoite is the first stage of parasite in RBC. This merozoite is in liver. Okay, and the first sporozoite was in the salivary gland, and this trophozoite is the first stage. This is important MCQ question. Okay, we will discuss later. The next is your sygont. Okay, this is next stage having multiple, here one chromatin mass, and this in sygont there will be multiple chromatin mass. Okay, and each of which this sygont will develop into merozoite. Okay, each of the chromatin mass basically is responsible for the formation of new merozoites. Clear? Okay, so within the RBC, merozoite will convert into trophozoite, that will lead to formation of sygont, and ultimately there will be, after hydration of hemoglobin, there will be RBC lysis, and that RBC lysis will cause release of huge amount of merozoites which will infect additional RBC. Okay, so this is the basic pathogenesis and life cycle of the Plasmodium. The important MCQ question are the trophozoites, the first. Okay, so the important question is this, the sygont, and on the basis of this chromatin mass. Okay, and sialic acid residues which is present on glycophorin, present on RBC, lectin-like molecules. So these are the important points which you must focus on. Clear? Now coming to the characteristic of the malaria. So characteristic of the malaria is paroxysmal fever with chills with rigor. So these three are the characteristic property of this malaria. So remember, the first stage is your sporozoites, then your merozoite, then your trophozoite, then your sygont. Okay, so these are the important characteristic of the malaria, classical characteristic of the malaria. Clear? Now moving to the next part. Now one more important point which I want to discuss here, gametocyte stage. Okay, so gametocyte stage is basically sexual form. It also formed inside RBC that infect the mosquito when it takes into the blood meal. Clear? So gametocyte is also formed inside the RBC. Very less amount of gametocyte is formed, but it will be formed inside the RBC. And when RBC will rupture, then this gametocyte will also come into blood. Okay, and when your plasmodium will bite, will take blood meal, then this gametocyte will enter into that plasmodium, and because this is sexual form, so it will lead to the formation of your next, okay, trophozoite, and like that means in plasmodium salivary gland there will be formation of your sporozoite, and ultimately the same cycle will get repeated. Clear? Now coming to the some important points, some important characteristic about plasmodium falciparum. Why plasmodium falciparum is so dangerous? So there must be some important characteristic which are associated with the plasmodium falciparum. So the first important point, that it is able to infect RBC of any age. Okay, this species is able to infect RBC of any age. Clear? Now it can also cause infected RBC to clump together. It is known as rosette formation. Okay, and so therefore it causes RBC to clump together. That will be known as rosette formation, and this clumped RBC will stick to your endothelial cell. This clumped RBC will stick to endothelial cell, that is known as sequestration, and this sequestration will lead to blockage of blood flow. So there will be blockage of blood flow due to this. Clear? Now the next is your PFEMP1, that is also known as Plasmodium falciparum erythrocyte membrane protein 1. No, Plasmodium falciparum erythrocyte membrane protein 1. It also associate and it forms knobs on RBC surface. Suppose this is RBC, so these are the knobs which are formed on the RBC due to this, okay, protein. Getting? And this knob which is formed of PFEMP1 will bind to endothelium, okay, using your CD36 or VCAM1 or your ICAM1 or E-selectin. It can use anyone, okay, and it will bind to the endothelium. Clear? And same, it will bind to endothelium, then it will cause your rosette formation, endothelial sequestration, and the blockage of blood. Now the next point, that RBC sequestration, which we discussed, will decrease your tissue perfusion. It will lead to decreased tissue perfusion, and that may lead to ischemia, and this is basically responsible for cerebral malaria, the major cause of death in children with malaria. Okay, this is the cerebral malaria is the major cause of death in children with malaria. Now the next point, that merozoite surface antigen. The merozoite surface antigen are released from infected RBC, and it will lead to induction of formation of TNF, interferon gamma, interleukin 1, that will lead to suppression of RBC formation. It will lead to increased fever, increased production of reactive or nitrogen species. Clear? So these are the important points which are related to Plasmodium falciparum. Now coming to the next point, that there are some forms of mutation in RBC which will lead to high prevalence of malaria. Okay, so mutation in RBC which causes high prevalence of malaria. So the first mutation related with this your point mutation in your globin forming genes. So point mutation in globin genes. Okay, and examples are your HBS, HBC, that is hemoglobinopathies, sickle cell anemia disease. The second is your mutation leading to globin deficiency. Mutation leading to globin deficiency, and that is your alpha beta form of thalassemia. Okay, alpha and beta forms of thalassemia is related to this globin deficiency. The third, the mutation may affect your RBC enzymes such as your glucose 6-phosphate dehydrogenase. The next is mutation which may cause RBC membrane defects. So there will be membrane defects, okay, such as absence of dark, that is Duffy surface blood group. Clear? Absence of dark, absence of your band 3, absence of your spectrin. So they are the proteins which are responsible for the membrane integration of the RBC. So there will be point mutation in globin genes, globin absence will be there, and alpha and beta thalassemia, RBC enzyme will be affected, RBC membrane will be affected. If these are occurring, that this will increase the chances of the malaria. Getting? Now coming to the morphology which we observe during diagnosis. So first coming to diagnosis. So examination of your Giemsa stained peripheral blood smear. Okay, this is usually done for diagnosis. Giemsa stained peripheral blood stage. Okay, in this asexual stages of parasite along with infected RBC will be easily identified. So asexual stage with RBC is easily identified in Giemsa stained peripheral blood cell. So this is important MCQ question again. Okay, this Giemsa stained peripheral blood smear is used for the malaria. Now moving to the next point. Okay, that the Plasmodium falciparum infects may lead to splenomegaly. Okay, it may lead to splenomegaly due to both congestion and hyperplasia of red pulp. Due to both congestion and hyperplasia of the red pulp, there may be splenomegaly, and spleen may eventually exceed your 1000 gram in weight. Clear? The next is liver enlargement. So liver enlargement is also seen. Okay, Kupffer cells will be heavily laden with malarial pigments, parasite and cellular debris. So these are the changes in your liver. Okay. The last important point that we are going to discuss about in cerebral malaria. Okay, so brain vessels are generally, suppose this is brain vessels, so brain vessels are generally plugged with parasite RBC. Okay, same, that is ischemia, that will cause ischemia. Okay, same, around vessels ring hemorrhages and a small focal inflammatory reactions are present, which is known as your malarial or dark granulomata. Clear? So this is another important MCQ question which is related to cerebral malaria. So thank you for watching. Best of luck.